Thanks very much, Kelly, and thank you, David, for joining us. You reaffirmed your guidance this morning ahead of your appearance at JP Morgan. Tell us what you're seeing in terms of COVID and the costs given this latest Omicron wave.
Sure, Bertha, good to be with you today, and I hope you're well. The fourth quarter of 2021 is clearly an environment where, again, we see elevated COVID. And the Omicron variant is obviously, as we all have learned, highly contagious. So, for example, we've seen the most number of COVID confirmed cases in our portfolio in the month of December than any month since the start of the pandemic. But importantly, we've also seen the lowest percentage of those cases make their way into needed hospitalization. So it's proving to be less acute from that standpoint. And lastly, we also see an increase in testing continue to manifest itself. Even with that taken as a whole, to your point, we're able to reconfirm our full year outlook for 2021 and reconfirm our expectation for growth of at least 10% EPS growth for 2022 because of the breadth of our portfolio, our broad service portfolio, and our ongoing really attractive growth across both of our U.S. business portfolios.
You talk about testing. Of course, the administration has now issued the new rules where health insurers will have to reimburse patients for over-the-counter testing, which is different from offering free testing with a clinician. What are your thoughts on what they're saying? They're saying essentially $12 per swab. What is that going to mean for you, and how are you going to implement that starting this Saturday?
Yeah. So first, Bertha, really important point to go back. I'm really proud of the industry as a whole, where at the earliest onset of the pandemic, the industry as a whole stepped forward immediately and said the industry will take on the cost of medically necessary testing. That's an example of, I think, good constructive public-private partnership and driving forward. Fast forward to your question where it stands today. As you said, that rule was just put forward. It needs to be implemented within a few days. The good news is within our organization, within our Evernorth service portfolio, we already stood up some solutions for clients to opt into to cover the at-home testing and provide access to at-home testing at certain providers across the country. So we're a little bit of a step ahead relative to that. And then what it means on a go-forward basis is to be determined. But when you think about the antigen test, an antigen test costs $12.50 per antigen test. You could do 10, 15 antigen tests for every lab test. So we think you're going to see a change in terms of the number of lab tests that are done for more antigen tests. Also, ideally, we'll see and be able to diagnose some COVID events earlier on in its impact, and then take some other costs out of the system. So to be determined in terms of the overall cost equation, we believe it's manageable in our portfolio, and we're positioned with our Evernorth service portfolio to be ahead of this adoption of this new rule.
If I'm a Cigna member, how will this work for me? How do I get reimbursed? How do I get, you said that your Evernorth services department has already been ahead of this. How do I get a free test from them?
So remember, when you ask that broad question, there's a variety of ways you can establish your relationship with us. If you're in a commercial relationship, remember that 85% of all of our commercial relationships are what's called self-funded. So it'll depend on the terms that the employer puts into position for you. If you're in the risk business or guaranteed cost business, we'll determine it and we'll reach out to you. In short, you'll access it one of two ways based upon the way the market works today. If your employer or your program opts into the existing Evernorth solution, if you go to one of the participating locations, you won't have to pay anything. We'll be able to square it away for you. The way the rule is set up that you've just articulated, if you're accessing the service in some other way, shape, or form, you'll submit a claim for reimbursement relative to your outlay. And as you know, the rule has a cap in terms of the cost per swab. And I believe it's 8 units per month per person from that standpoint. So it depends on how your relationship is established. Our objective will be to make it as easy as possible for the customers we serve.
And not much time left, but, you know, just as Tom Brady can change the game in those last few seconds, do you think this, for you, as you look at the fact that you've got MD Live, Evernorth, to try to meet members where they are, do you see home testing becoming a bigger factor in terms of that kind of primary care?
Yeah, we see, Bertha, more broadly to your really important point, the ability to harness technology and have a digital first offering. So through our MD Live capability and our digital services capabilities, the ability to bring more services to the palm of the hand of the individual is mission critical on strategy for us in accelerating both primary medical behavioral coordinated, as well as chronic care, musculoskeletal, diabetes, et cetera, from that standpoint. And then the ability to extend that in the home by augmenting the home. So testing is, I think, an indicator of it, but broader healthcare coordination that is highly personalized, efficient, coordinated, that takes fragmentation out of the system, and cost effective. That's what we're extremely excited about. And with Evernorth Care is focused on bringing those services to market, and we've stood up multiple of those services already for 2022.
David Cordani, thank you so much for joining us. Really appreciate it.